Good morning, doctor, and thank you so much for accepting to speak with Pacha Foundation this morning. So can we know who Dr. Ngwa is?
Dr. Ngwa is a pediatrician in Douala, a Cameroonian by nationality. I was trained in the deported Soviet Union then, and I've been working in Cameroon from graduation. I started working in Cameroon in Bafoussam in 1986. I worked there for 2 years, and from then I was transferred to Douala to meet my family in Douala, and I've been working since 1988 in Douala. I started working with La Quintini, but 2 years ago I'm on my own as a private practitioner in Douala.
Doctor, so how did you start in the medical profession and what was your motivation?
It started when I was a kid. I used to have a lot of episodes of malaria. I was always sick, and I could take my medication easily, and as soon as I felt the symptom, I would just walk and take my Nevaquin, and I used to take it the dosage was correctly and everything, and I started nursing the idea that in future I'll be a doctor, so I need to take my medication very carefully so that when I have my own patient and they will take their medication also, I would at least know what it means to give medication. So that's where my inspiration came. I normally used to have malaria a lot.
Okay, Dr. Ngwa is a pediatrician. Why pediatrics?
I have a lot of passion for children. They are the helpless, the voiceless, and there's a lot you learn from children. They are very honest. If a child is sick, you know. If a child opens his mouth and tells you that he's sick, he's really sick. But in adult medicine, there are a lot of fake patients. They come and try you a lot, but children, they don't try you. They cannot tell lies. They are very truthful. They are honest, and you work with them easily. They tell you what they feel, and when even if you hurt you, they are just too honest with it. So I love them a lot.
Okay, doctor, you are one of the volunteer doctors for the Michael and Mauricia Pacha Foundation. You've worked with the foundation for some time now. So we also like to find out from you what benefits you have rendering your services to humanity.
I'm just satisfied. I'm just happy that I'm part of those who put smile on people's face. I just feel elated. For me, it's a privilege to work with the foundation because I see so much joy in people, the anxiety. There are so many people in Cameroon that cannot afford basic medical care, not to talk about special care. So if there is a foundation in Cameroon like the Pacha Foundation that can make that impact being felt, I think it's just a privilege for me to be part of it. Because if you work alone, the impact is not there. But together and in unity, we can move forward.
Doctor, you worked with the Pacha Foundation in the Southwest in 2013 during the Foundation's medical mission, and in the Northwest and West regions in 2014. So what is Dr. Ngwa putting in place this year to ensure the success of Pacha Foundation's medical mission in Edea and Kribi in June?
The Pacha Foundation, I worked in Nimbe, Southwest, maybe in the Western and Northwest province, and I feel that every time you get closer and closer to the people. The first time it was like you didn't know how to forge ahead. The second time is you make corrections for what you didn't do well during the first volunteer service. And the third time, I think we are going to perfect those points that we missed out during the first and second. So I think how we can contain the crowd, how we can use our time usefully. That is, I think, because at first when you just come to the field with a lot of people, especially in Bamenda, you get confused. So I was thinking that this time I think it would be better for us to have a free medical visit before the medical visit, if it's possible, so that we some sort of coach the people, so that it's not, if you are coming, you should not just come for everything. You should come for a particular problem that you have not been able to solve. And if we cannot solve the problem, at least we can give you directions how to help yourself. I think that it will be more constructive if we work in that light.
Thank you so much, Doctor. So, how can someone locate Dr. Ngwa in Douala?
Okay, you see, this is my center in the course of creation, and it is located in Bepanda. If you say in Cameroon, it's very difficult if you don't have fixed addresses, streets. People don't follow streets, but this is, if you say Express Union Bepanda, I think you'll get here. Express. So this place will be Flame of Love. Flame of Love of the Immaculate Heart of Mary. That is the name of this center.
So let me find out again how you get in touch with your patients. You are located in an environment which if someone can pass here and you may hardly notice that this is a health center. So how do you get in touch with your patients?
I would like to tell you that I've been working in this place since getting to 15 years. So when I was working with the government, I was probably working here. I was working here only in the evenings after work from 4 o'clock. So my patients from La Quintiné Hospital and from the surroundings, they know that I've been here in the evening. So when I finally retired from the public service and decided to open my own medical